Welcome, viewers. I'm Dr. Ann Clark, CEO of ACI Specialty Benefits. And today I'm here with
Navid Zamani,
who is an MFT counselor at ACI, and we're going to be talking about threat assessment. Every day in the newspapers, we read of yet another tragic occurrence, whether it's an act of nature, whether it's a shooting, whether a child is involved. Terrible things are happening, and they affect families, observers in the workplace in a very serious way. Also, workplace violence has become more common, and people who are in the workplace become concerned when an employee acts in a strange or unpredictable way, and begin to wonder if that employee is capable of some sort of violent action. In this instance, Navid, I think we turn to the HR director often, or a manager or supervisor, and the term threat assessment is being used. Can you describe for our audience, what is threat assessment?
A threat assessment is basically when a qualified clinician comes in and is able to use several tools and skills available to them to assess the situation in a professional and structured way. For instance, this typically looks like assessing whether the individual is at low risk or high risk for acting upon any threats that they've made, as well as the protocols that are in place set by the company and HR to deal with such a threat. A history of violence and aggressiveness is typically a good indicator of future behaviors that would be harmful to the company or other employees. Additionally, taking a look at the community of support around the threatener is very important, because isolation is also a big contributor to aggressive behaviors.
And at the same time, Navid, we don't want to label any employee who's a little eccentric or having a bad day or maybe swore in the workplace as a threat. What kinds of warning signs would suggest that a professional like you ought to be involved, at least in a discussion with a manager or supervisor?
Right. As we've all experienced probably in our personal and professional lives, people have different ways of managing stress. And some people tend to veer towards kind of the more extreme, or release steam by kind of making aggressive or hostile threats towards others. While that may be the case, it's also important to consider really what the person is capable of and whether they would be willing to act on these intentions. So with the assistance of ACI, we would kind of employ our internal clinicians to be able to assess the context that the employee is in. So like I mentioned earlier, the community support, whether the person has a history of mental health issues, how they interact and relate with their coworkers, how they interact and relate with authority figures at the workplace. All these provide clues and information on how to act and react.
So it sounds like to me, Navid, that a manager or a supervisor who is unsure of which way to go could simply make a phone call to you, and that would be confidential and anonymous. And so you could discuss the performance-based issues, the kinds of behaviors that the supervisor, manager, or HR person is seeing. Really, anyone could call you. It could be a coworker, to get a perspective on whether a next step should be taken. Is that fair to say?
Absolutely. We're available at all times to be able to connect with the concerned person. And like Dr. Clark said, it's confidential. We follow your lead in terms of what actions to take. And we use our own clinical judgment and training to provide the best advice that we can.
So, as we've been talking, there are scrolling information on your screen of how to contact the Employee Assistance Program, the Student Assistance Program, or many of the other ancillary programs we have here at ACI. You can always speak with a clinician, and remember, this is a nationwide service, so we have a network of 40,000 clinicians who are trained and prepared to discuss the subject of threat assessment and employee behavior with you. So it starts with a phone call, and we thank you, Navid, for being with us today and sharing your perspective.
Thank you.